You'll have seen the reports about Suella Braverman and whether or not she asked civil servants to arrange this private speed awareness course for her. What's your sort of reaction?
I think Rishi Sunak should launch an investigation into it. He should ask the independent advisor whether she's breached the standards of the ministerial code here. I think a lot of people watching this programme will think, you know, why is it always one rule for them and another rule for everybody else? But, you know, Suella Braverman's got form on this, hasn't she? You'll remember she actually had to resign as Home Secretary under Liz Truss because she sent confidential documents to a Tory MP when she shouldn't have done that. And Rishi Sunak reappointed her as Home Secretary. Why? Because he had to keep the right wing of his party on board. So there's no point in him getting all tetchy at the G7 press conference. It's because of him that she's there. So I've got my own views about that sort of behaviour, but actually what he should do is launch an investigation to make sure we get to the bottom of this and to see whether she has actually breached the ministerial code.
And I guess what defenders of Suella Braverman might say is that there isn't really one rule for her and one for everyone else, because she did try to do the speed awareness course and then in the end ended up accepting the points on her licence.
But why did she ask civil servants? Don't forget, she's the Home Secretary, asking civil servants whether there should be a different arrangement that the rest of us have to have for her. Is that the highest standards of probity and integrity that we should rightly see from our ministers? I don't think it is, but actually what Sunak should do is launch that investigation.
We'll have more on the story, of course, as it develops, as the day goes on. The wider story when it comes to the Home Secretary, of course, is the net migration figures that we're expecting out next week. Rishi Sunak's been very clear. He says that he wants to bring net migration down from the current levels of around 500,000. He thinks it's too high. What's Labour's position? Is that too high and do you want to see it come down?
I expect it to come down, and it should come down. And I think the real issue here is this, that in Labour's points-based immigration system, we have to tie up what we're seeing in terms of a skills gap in our population and actually put in place the programmes to deal with that so that we don't have to have the work visas that we're seeing at the moment. I mean, just look at health and social care. That is the area where the highest number of visas are being issued at the moment. But what does the government do? It cuts medical school places this year by 3,000, denying opportunities for bright young Britons to have a fantastic job in our NHS. Social care, the government, we've just heard, has halved the funding it promised in its white paper for the social care workforce. So that is the wrong approach. Where we have skills gaps, Labour has said we will set up Skills for England to identify where those problems are and put in place those proper training programmes.
It's interesting to talk about the health sector and in terms of those migration figures, because, as you say, we do see a huge number of people coming from abroad to work in our health service, nurses, doctors, care workers. Is that a problem?
I think we should be doing more to make sure we have the proper training in this country.
And why is that? Is it because it's a risk to rely on people from abroad? Why is it?
Because I think it is a fantastic career and opportunity. I look in my own sector of social care. You know, care workers do some of the most important work in this country, looking after the people we love most, our elderly and disabled relatives. I think this is a huge area of growing demand in future. We know that our population is ageing, and I also think by having properly trained and paid care workers in every part of the country, that will make a huge contribution to our economy too. So let's champion that rather than undermine it.
Tomorrow, Keir Starmer's giving a speech on the NHS. He's going to say the NHS is not sustainable unless we make serious, deep, long-term changes. So what are the changes? What's the idea?
So when the NHS was created, average life expectancy was 63. Now it's 80, and 1 in 4 babies born today is set to live to 100. Back then, the major cause of death and disease was infectious diseases and accidents. Now it's long-term chronic conditions like cancer, heart disease and diabetes. A quarter of us are living with 2 long-term conditions or more, and a third of people who end up in A&E have 5 conditions or more. Our NHS is not set up to deal with those problems.
So what's the idea?
The big thing is to get the shift towards prevention, early intervention and more support in the community at home. It's about bringing together all these separate teams into one place. If you've ever had to deal with an elderly relative stuck in hospital, you have to battle your way around the system, ringing 5, 6, 7 people. What we need is one team to help keep people at home.
So when you talk about prevention, one of the things the levers of the government have is regulation. So taxes, for example, on sugar, more regulation around junk food. Is that what Labour would do?
We do want to see a ban on junk food advertising targeted at children and young people.
What about taxes on unhealthy food?
I think what we have seen with the sugar levy is that one of the things the government has done is that has made a difference. So we will be looking, and you'll forgive me for not making all the announcements today, you'll have to wait and see until the mission tomorrow. It is about shifting the focus towards prevention, but it's also about transforming those services.
If you're comfortable about making food more expensive at a time when people are really struggling to pay for food?
Actually, I've seen here in the past when Labour was in government that actually having a fair regulatory system where you are taking action on sugar and salt in people's foods did make a difference. But I would say to you too here, Sophie, it is about far more than that. It is about radically shifting the focus of services out of hospitals into the community, joining them up around the needs of patients and users, because that's what we need to live longer, healthier, more independent
I know we'll
lives.
get more details tomorrow. Always a slightly frustrating time
I'm sure
to do an interview,
sure
to be completely honest with you, as a result. Now, Keir Starmer says money's part of it, but it's not just about money. But money is a part of it as well. You're talking about social care, right? And big problem, the reason we've got so many vacancies in social care is that you can earn more money working at supermarkets. So why would you stay in social care?
Can I just come back on
Labour say they want a national care service with as much ambition as the 1945 NHS. Realistically, is Labour looking at putting up taxes in order to fund some of the changes?
No, and can I just come back to you on that point? I actually used to say the same. It is true that you can earn more working in supermarket or hospitality, but actually a third of people, 1 in 3 who leave the care workforce actually go and work for the NHS.
OK.
So we need a joined-up workforce plan there.
But I'm talking seriously here about money, right? Because you're talking about you're talking about 1945-style reformation of a national care service. You're talking about chronic staffing shortages. Are you looking at potentially wealth taxes? The reason I'm asking this is back in 2021, Keir Starmer was asked how he would fund an increase in social care funding. He says those that earn their money in ways other than work should pay their own share. People who earn their money from properties, dividends, stock shares, they should be looked at. So that was back in 2021. I assume you have been looking at it. Are you looking at wealth taxes to try and bolster?
We're not. And you'll know that I'm not going to sit here and pluck out figures out of nowhere when goodness knows what the state of the economy will be by the time of the next general election. We've been pretty honest where we do want to see increases in investment, where we'll get the money from. We've said that we'll scrap the non-dom tax status in order to fund the biggest workforce expansion in the NHS's history, 10,000 more nurses, doubling the number of medical school places, 5,000 more district nurses to keep people at home.
You'll forgive me why I'm sceptical that you're planning the biggest transformation since 1945 when the NHS was created if you're not saying that there's going to be any more money to fund it.
But whilst extra investment is essential, what I would argue here, Sophie, is reform is absolutely part of it too.
Sure.
That why have we got? But we have said we'll increase funding to support.
3.2 billion from non-dom tax status.
Yes,
tax
now
in private schools, 1.7 billion. I mean, this is not enough.
Well, I don't think money alone is the solution. And if you don't think 10,000 more nurses and doubling the number of medical spaces...
I'm questioning whether you can do a reform similar to 1945 when you're talking about, you know, around £5-6 billion extra money.
But this is about reform. Why does a family have to ring 6 or 7 different numbers to try and get the services that their elderly parent needs? Why don't we have one team? Because there's one person and they don't see their needs in separate service silos. Reform can make a huge difference. If you look at delayed discharges from hospital, £1.7 billion spent last year on elderly people in hospital who didn't need to be there. Imagine the difference that could make if that was spent in the community or at home. Reform alongside investment is what we need to make the NHS fit for the future.
OK, thank you very much for being on the programme. Liz Kendall there for the Labour Party.